My child wets almost every day in the bed. He is 8 years old. His father also had the same problem. Is it a serious disease? Let's see in today's video. Hi friends, I am Dr. Karamat, pediatrician, and this is Scientific Doctor. In this channel, we discuss about medical science related information, videos on myths and facts. If you want such videos, kindly subscribe. Also press the bell icon for instant notifications on new content. In today's video, we are going to see a very common problem, bedwetting or enuresis as we call it technically. Enuresis is a very common problem. Almost 15% of individuals said to have this at 5 years of age. This decreases to about 1% or even less than that by 18 years. Before looking into the causes, we must understand what is the definition of enuresis. A child is said to have enuresis when he has inappropriate voiding into the clothes or during the bedtime beyond 5 years of age, at least twice in a week for more than 3 months. So it is obvious that when the child voids less than this, that occasionally once in the bed, it is not a disease and you need not worry about it. In order to understand enuresis, we must understand about bladder control. Every child, when the child is born, doesn't have bladder control. The child voids as and when the bladder is filled. So developing bladder control is a maturation. So enuresis is a maturational delay. What are the factors involved in attainment of bladder control? First of all, we must have a sensory awareness of the fullness of bladder. Second, we must have voluntary control over the sphincters. Third, the child must have a psychological desire for control. A 1-year-old child may not have that desire, but as the child ages, it develops a sense of guilt when it passes into the clothes or during bedtime. So it develops a sense of psychological need for control. Also, importantly, the child should have a positive training experience. What do I mean by that? Essentially, when the child is around 2 to 3 years of age, initially your daytime control develops first, then the night time. During this period of training, if the child is abused or subject to a very strict bladder training, it may have a negative impact and the child may continue to be enuretic. We classify enuresis into two types, primary and secondary. Primary is when the child has never attained any control over the bladder, or secondary when the child has had a control for more than 6 months and then develops enuresis subsequently. Secondary enuresis is often said to be due to urinary tract infections or due to psychological factors like a loss in the family or an event having severe psychological impact on the child. What are the causes of enuresis or bedwetting? The first one is genetics. Approximately 40 to 45% of children with one parent who has a history of enuresis will be having enuresis, and when both the parents have this history, 70 to 75% of children may have it. The second factor is a sleep arousal dysfunction. It has been shown that in studies that enuretics or children who wets the bed have a relatively deep sleep and are very difficult to arouse from sleep. The third important cause are the bladder issues. Some children may have a small bladder capacity while some others may have an overactive bladder. Fourth, as I said, is a very strict bladder training which leads to psychological issues. Fifth is nocturnal polyuria. What do I mean by that? Some children tend to have more urine output in the night than in the day, especially caused by drinking more fluids in the evening than in the day. Some others simply have a maturational delay. Having seen all the causes of enuresis, when do we rush to see a doctor? There are certain red flag signs or danger signs in enuresis where you should rush to the doctor immediately. When the child has pain or irritation while passing urine. The second, when the child has more thirst and more urine output during the day as well as during the night. Third, when the child not only has problem in bladder control, also over the bowel control. That is, the child passes his or her stools in the clothes itself, that is called encopresis. Also, when the child has snoring or abnormal sleep, you need to consult the doctor. And when the child has gait, that is walk disturbances or problems in the spine, you need to rush to the doctor. When you don't have all these red flag signs, probably it is worthwhile to try simple measures at home before going to a doctor. What are these measures? First of all, the child should be motivated for bladder training. Nighttime wearing of diapers is a strict no-no. Whenever the child has a dry night, the child should be suitably rewarded. We should restrict the fluid in the evening to balance out, take more fluids in the daytime and avoid taking fluids in the last 2 hours before going to sleep. Avoid caffeinated beverages including coffee and tea, and also chocolates and citrus juices, especially in the evening, because they promote urine production. So whenever we are motivationally training a child for bladder control, punishments are to be strictly avoided whenever the child voids into the bed or in the clothes. If the child doesn't improve after 3 to 6 months of training with these methods, or if the child has any danger signs, immediately we should visit a doctor who may order some simple tests with urine, sometimes rarely scans, and very rarely some complex tests called urodynamic studies. Based on the results, the child may be advised motivational therapy as mentioned earlier, or behavioral conditioning, that is called alarm therapy. What are these alarms? These are commercially available in the market. These alarms are attached to the bedding where they sense moisture when the child voids urine, and immediately an alarm is sounded. With that sound, the child wakes up and passes urine. With time, the child learns to sense the bladder fullness even before the child passes into the clothes, and the child attains bladder control. In spite of these measures, if the child continues to pass urine into the bed, there are drugs which can be used to improve this condition. My child is 9 years old, still he voids into the bed regularly. Will he not improve? What is the prognosis for this condition? Don't worry, as enuresis improves 15% every year. So as the child grows older, this problem is going to get better. This was a short video on bedwetting. If you like this video, please subscribe to this channel. Kindly share this video to your friends if you find this useful. Thank you. Till the next Wednesday.